Hi everyone. We will get started as it's 2 minutes past. Um, as you can see, we've a bit of a busy session this afternoon. Um, we will go through welcome and introductions. I'll hand you over to Barry, who will give an overview of this week's key messages. We've an update from Southwest London CCG, so Amanda's joining us and she'll give us an update on the vaccination programme in Merton. We will then go into Champions Corner. And so if you have any questions or you'd like to raise anything, please do in Champions Corner. And then today's theme, we have the reopening of schools in Merton. And we're joined by Julia Groom and Elizabeth Fitzpatrick, who are going to talk to us about how schools have reopened safely. And we'll have time for questions and discussion, and as usual, next steps, and we'll finish by 1. So I'd see a couple of people have already started us off, but if you want to take a minute to introduce yourself in the chat box, you can use the chat box throughout the session to ask any questions or raise any comments or suggestions. Just a little bit of housekeeping. We do ask that you mute your microphone when you're not speaking, just so we can prevent any feedback and hear the person who is speaking. But as usual, you can have your camera on or off. It's completely up to you. And I'll hand you over to Barry for this week's key messages.
Thank you, Una. Thank you, champions, for joining us again this week. It's continued good news, champions. The new infections in Merton are continuing to decrease. So we knew that the lockdown period has worked within Merton and across the country. So if you remember, pre-lockdown, around that New Year period, we were getting in Merton, give or take, around 300 cases per day. The numbers have now dropped significantly to around 20 new infections each day. So that's a fantastic drop, but they are still too high. We need to do more. We need to drive down those new infections even further. And then thinking through the roadmap, which we spoke about last time. So schools have reopened, and I'm really delighted that Julia and Elizabeth are talking to us today. But each step of that roadmap opens up more opportunities for virus to transmission. And so we know that our school staff are working incredibly hard on making the environment safe, but our behaviours are really important too. So if we're going to make it to that next step, the 12th of April is the next step. What we do now makes a difference on new infections and that virus transmission. So my question to you today, champions, and to have this conversation with your colleagues, your friends, your networks, is around what matters to you. So what is it that's going to make you think twice about giving that person that hug outside the front of the school gates? What's going to make you think twice about getting a test if you have symptoms? What's going to make you think twice or really encourage you to take part in regular LFT testing? Or what matters to you enough to make you to encourage you to take that opportunity to get a vaccine when you get that call and that email from the NHS? So think about that. So is it going to be the opening up of retail? Is that the thing that's going to be that you're going to comply with those rules and the regulations? Is it the fact that you're going to get married soon, and if we drive the cases down further, we can have more people at our wedding? Is it about going to restaurants with your family and friends? What's that thing that matters to you that's going to make you follow those guidance and those rules so that we can drive down those cases further within Merton? For me, it's my daughter's birthday next week. She's going to be 10. We're going to have to do it at home. So what's going to make me want to follow those rules even more closely than I am already is about the opportunity to go out and celebrate with her. But also, I want to go to the rugby club and have a beer. Those things, that society, it's so close to us right now, but the actions and the behaviors that we take right now are going to drive those numbers. Okay. So the second bit is around test and trace. Champions, you've been hearing me talk about this since September, but test and trace and isolate is a key part of our approach to controlling that virus spread. So if you have symptoms, even mild, if you're not too sure, have I lost my sense of taste or smell? Please isolate with the rest of your household and get a test. And you can do that from the NHS website or by calling 119. And the important other side of testing, as you know, champions, is about regular asymptomatic testing. So if you are a frontline carer, a frontline staff, carer, or a volunteer, I would really encourage you to take part in regular asymptomatic testing. But also, if you have children in the house, or you're a household or a bubble of school staff or pupils, then you are now eligible to take part in that program. And again, these testing programs help us break the chain of transmission and are helping us to achieve that second step in the roadmap. And again, champions, as you know, testing by itself does very little. It's really important that if you get that positive result, to please stay at home, break that chain of transmission, but also respond to those text messages and emails and calls from NHS Test and Trace, who you heard from a couple of weeks ago. Vaccinations, I'm not going to spend much time talking about vaccines today because we've got Aman with us today. So thank you, Aman, for coming today. But it's really important that, again, that our residents that have had their vaccine continue to follow the rules and those guidances. So those non-pharmaceutical interventions help keep us all safe. So hands, face and space. But really importantly, again, that even if you've had that vaccine, get tested if you have symptoms, and you must isolate if you're positive or have been identified as a close contact. And then if you're eligible, so if you have a household or bubble of school staff, to take part in regular testing. So they're the things that kind of keep us safe, and we're so close to opening up lots of other things that we all want to be doing, so we need to focus on those things. But the final key message from me is a thank you. So again, as you know, champions, we had an enhanced testing program in Wimbledon Park. That finished last Friday, and again, very similar to the experience in Pollard's Hill, we had a wonderful response from our residents, workplaces, schools, voluntary sector, who took part in this program. It's an asymptomatic testing program. We know swabbing's not particularly pleasant, but we gave out 5,000 tests. We had a fantastic response. So we're just awaiting the results of those positive cases, because all of those positive cases will be sent for sequencing, so we can see if there are any other cases of the South African variants within the area. And we will, of course, share the findings and the lessons learned with the community, and we will come back to our champions to explain what we've found, if anything, in a future date. So they're the key messages, champions. I'll hand back over to Una to take forward the rest of the agenda.
Thanks, Barry. Sarah, I see your hand is up. I'll come back to you in Champions Corner if that's okay, because I'm going to hand over to Aman now, who's going to talk about the vaccination rollout in Merton.
Thank you, Una. Sorry, I'm just trying to turn my camera on. Hi, everyone. Thank you, Barry and Una, for inviting me here today. I'll just give you a quick update into the vaccination programme. In terms of, I'll start with our engagement. So far, you all know that we're engaging on the COVID-19 vaccination. I know we've come along to the Champions drop-in session a couple of times now. We've held 28 engagement sessions so far and have engaged with over 750 community members, and this is slowly but steadily increasing now. We have lots more engagement sessions lined up, and we're trying to continue to reach out to our community members by different formats and forums. So if we haven't come to your community group, please do let us know and we can come along. So what I also wanted to update on is we are delivering the vaccination in kind of local GP settings. So you're all aware of the Nelson and the Wilson, where you can go along to get your vaccination. But there are also numerous community pop-ups, and Dr. Vass has just joined the call as well now, so we have him as well. So we have lots of community pop-ups that are coming up. Recently we held one in the Ahmadiyya Mosque, and we vaccinated 1,000 people in one day. So it's a really really, really great turnout there. You do have to be eligible for the vaccination to attend the community pop-up, and there are you have to book an appointment to attend. So it is different for which pop-up you go to. Some are asking for you to email them, and they'll then give you the booking instructions. But what we wanted to do is get your suggestions really on where in the community a pop-up would be helpful, particularly if you've got any ideas in the east of Merton, and if you've got connections into those organisations or settings, that would be really helpful as well. And if you've been to a community pop-up and want to share your experience, please do share that with us as well.
Thanks, Aman. I guess that brings us into Champions Corner, and if anyone would like to feed back any of the points that Aman's just raised there, it's a good opportunity to do it here. Who'd like to get us started? Or touching on as well Barry's point that he raised earlier about what does it mean to you? What's important to you that would make you think twice about perhaps what would make you think twice about perhaps giving someone a hug, or really thinking about the guidance and following it quite strictly? Barry gave a great example of his daughter's birthday. I think we've all got things that we'd really like to get back to doing and seeing friends and family. Sarah, I see your hand is up.
Hello. I just wanted to sort of touch on Barry's point and say actually my independence, actually I rely on the public a lot and public transport, and I ask for help quite a lot from people in the streets and all that, and so I rely on public support actually until we get to the point where I can actually ask people. I'm not going to be able to go out at all, so it's pretty important for me that everyone does follow the rules and actually get back to normality.
Thank you, Sarah. That's a really, really important point, isn't it? About people that we meet that we don't know as well. So thank you for sharing. I'll just check the chat box. Andrew, you had a question. Would you like to come off mute and ask?
Thanks, Una. Yes, it was just some comments from our members, which we record and group. Many are asking whether an annual vaccine boost is likely going forward. I just wondered whether there's any views on that at this stage. I realise it's very early days on things like this, but any information or comment on that, please?
Good question, Andrew, and this is what people are talking about, and I think it's very likely. There is no official decision yet, but it looks very much likely that we will need, with our excellent, in UK has to be proud of our excellent surveillance program we run, the genetic genomic surveillance of the vaccine, where we pick up the variants as they happen, literally. And therefore, I think marrying the genomic surveillance we do very well in the UK, and the way the vaccine is behaving, if you're going to put your money on it, you certainly can go and put your money on it. But please don't waste your money on it. But I think my money is on it, but it's only by word, not by actually parting with cash. Yeah, we will be having an annual boost, one shape or form.
Thank you very much. Thanks.
Thanks, Andrew. Thanks, Vasa. Has anyone any ideas on where they would like to see pop-ups, vaccination sites take place, particularly in the east of the borough?
Una, I think it's very important that it should not be a service based on the whim and fancy of Dr. Vasa. Where we do these pop-ups has to be based on the needs of the population, where we have population where we know there are barriers to access, or there are issues within the population, the individuals, because it's we, the individuals, who make up the population. So we really need to look at those individual characteristics and say, what is the solution? Is the solution a pop-up? or is there a different solution? I think we really need you, the people who are the grassroots people who meet the citizens whom I don't get to meet, to work out what is the need, what is the solution, give it to us, and then we will take it to the vaccine providers and say, okay, this is what this community needs. Because even if you told me there are 25 people who would get vaccinated, Vasa, if you made this minor adjustment, I want to hear that, because to me, those 25 people count. It's not just the 500s or the thousands we like to talk about. Even 5 people count to me, even 1 person counts to me. So you just have to come and tell us, for this particular individual, if you did this adjustment, it will work. Can you do it? If it's doable, we'll do it. If it's not doable, then we'll discuss it. But I really want it to be grassroots solution. But go back to what Dagmar, whom I think all of you know, or if you don't know her, you should know her. What Dagmar would say, need-based solutions.
Thank you, Vasa. Pam, I see your hand is up.
Yes, I wondered if Pollard's Hill could be considered for a pop-up centre. I think in that area there is something needed here, because it's quite a long way for some people to go to the Wilson or the Nelson, and I think Pollard's Hill might be a good place.
Just to build on that, Pam, so we have the New Horizon Centre is going to be one of the pop-up sites in Pollard's Hill. That's something that we're planning at the moment.
Oh,
do
right.
you have no, but that's really helpful. Do you have any other ideas in Pollard's Hill that would be particularly useful or particularly easy to get to?
Well, I mean, the 3 churches are quite easy to get to, but whether they would be suitable or not, I just don't know at this stage. I think New Horizon Centre is pretty good central for Pollard's Hill.
Yeah.
Good place. Yes, that's all I can think of at the moment. Yeah. Okay.
Thank you.
Thank you. Thank you, Pam, because one of my colleagues who is a GP at Wideway,
yes.
he is talking to, he did mention, Aman, he mentioned the name of a church, didn't he? He's talking to, trying to explore whether it's possible in that premises.
Oh,
but
right.
yeah, we are certainly looking into that.
Okay, good. Okay, thank you.
Thank you, Pam. Sarah, you've put a really good point in the chat box. Would you like to come off mute and raise it?
Thank you. Yes, it's Mother's Day this weekend, and a lot of people will have had or part of their vaccination and so forth. I wonder if it would be possible to have some sort of reinforcement message to just, you know, kind of, I know it's difficult, but you know, you can't hug your mum, and you should, you know, people should still be following all the guidelines and all the rules. And I know it sort of seems a bit, you know, kind of party pooping, but it's some reinforcement on keeping, you know, just sticking with it, and until we're allowed to, perhaps.
I think it's what I tell people who ask me this question. I always say, seek permission, because your mum may have vulnerabilities, or your next door neighbor may have vulnerabilities you don't know about, and based on one's individual's own risk, one is more willing to take a hug and not take a hug. And I think if you look out when you're driving or you're walking on the road, I suppose I do more than you do of walking on the road and driving at this point in time. You see a lot of people out there at the moment, and there is interaction going on there, but it's about individual risks here, and I think certain people are more vulnerable, and we really need to find out, respect, ask before we think things are getting better, because things are getting better at different speed for different people.
Thank you, Vasa. I think it's such an important point as well, and it touches on what Barry mentioned earlier, about making sure that we can reach the steps in the roadmap. So we'll share some resources with you on Friday about the importance of following the rules, particularly coming up to Mother's Day as well. So thank you for raising that, Sarah. Maria, I see your hand is up.
Oh, hello, Una. I was just going to get back to you on some of the pop-up sites. Now, I had a couple of suggestions of maybe some of the libraries. I don't know where they are in all the borough, but the libraries seem to be quite a good focal point for most people know. Vestry Hall definitely has been mentioned by someone else, was another option. And maybe some of the bigger supermarket car parks, there might be an idea of doing it there if there's enough space. yeah, it's just a thought, because people have to access their shopping and they're more likely to do it. I think it depends on what phase of the vaccination process. If you're just going back to general public, then it might be easy for them to access. But yeah, it's just a few options.
Yeah, absolutely. So you need to look at the 18 to 50-year-old cohort totally differently.
Yeah.
The way we look at the 70+ cohort, because yeah, you are quite right. You're more likely to find my daughter in a supermarket car park, or somebody else in a B&Q car park.
Yeah, definitely.
Rather than, yeah, absolutely.
Thanks, Maria. Andrew, you have your hand up.
Yeah, thank you. And I just wanted to talk about the LFT testing. They have been tremendous for us. We're so grateful for Merton for making these available. So we introduced some time ago now 2 tests per week for our frontline staff. So that's really, really good. What would be an additional plus for us is if we could obtain the tests and then distribute them to our staff at home to do. And I just wonder whether there was any sense of whether that might be likely in the or possible for the future, please, near future.
Thanks, Andrew. I'm going to bring Barry in here. Barry.
Yeah, thanks, Una. Andrew, thank you for taking part, first of all, in regular LFTs. It's really important that those frontline workers, carers and volunteers are doing that. So thank you, first of all, for helping on that way. We know that the national programme for those lateral flow tests is expanding every single week. So last week, the government allowed that home testing for households and bubbles of school children and staff. I fully expect more announcements to come in the next few weeks as we get nearer that roadmap. You know, the next big step is about the opening up of retail and some other businesses. I wouldn't be surprised if then an announcement came up that if you work in essential retail, for example, then you're able to take part in that program. So it's coming, Andrew. I know you've been really patient with us, so thank you. But again, if you or any of the other organisations that our champions represent need our help to increase the access or ability to use LFTs, then do let us know. We'll be able to pick those up with you outside the meeting. Absolutely.
Great. Thanks as always. Many thanks. That's great.
Thank you both. Sarah, you have your hand up. Is that a legacy hand?
Hi, just a quick one. I think there's a misconception out there about the first vaccine kind of and its efficacy and the kind of, oh, we're halfway there, but actually it's I was speaking to my niece, a 10-year-old girl, and she was under the impression that because I've been vaccinated, I've had the first one, that means that I can now see her more. That isn't the case. So perhaps for a universal message as well to children and adults about how the basics of the vaccine and the importance of remembering the upkeep of the non-pharmaceutical interventions with children and adults universally. Actually, if children are thinking like that, and they're not going to be as cautious too, and I think that's really important for the whole community to be aware of that.
Thank you, Sarah. That's a really important point. I will look to get some resources as well and share that with you on Friday about the importance of following the restrictions even after you've had your vaccine, and particularly for adults and children. So I'll see what I can get to you for that on Friday as well. Maria, you have your hand up. Is that a legacy hand?
Oh yeah, sorry, I thought I put it back down. Sorry about that.
No problem. I just don't want to miss anyone out. Pam, you have your hand up. Is that a legacy hand?
Yes, legacy, yes.
No problem. And then Sarah and Andrew as well. Are they new questions or comments? I just don't want to miss you out before we move on.
No, sorry, legacy from me.
No,
sorry.
it's fine. Okay, I'll just check the chat box.
Una, sorry, it's Barry. We've got Slavek's got his hand up as well.
Oh, Slavek, sorry, I missed you there.
Oh, thank you, Una. Thanks, Barry. Just a quick one on a pop-up centers. We are holding one today at Collierswood Community Centre with the Collierswood GP. And my question would be, because it's unclear, is it just one-off, or is it, be regular basis on weekly, monthly basis, or how does it work, the pop-up centers? How often we could be able to actually hold them?
Thanks, Slavik. Aman, can I bring you in here?
Yeah. Aman, I can help you out. So it's Slovak, it's needs based. So if we hope to run today successfully. We hope to do a fair number today, and then after that, it's really based on information from the ground. So if you come up with some numbers to say that you are aware that you can get, say, 200 people who, if there is a location there, will get it immediately, and they are considering it, if they go distance further away, then you are making the case for us to go back to the providers to say, come on, let's one more site in Collierswood. It may be somewhere else in Collierswood, I don't know, but it may not be on the high street next time around. It could be somewhere else next time, because we really need to give a fair chance. We need to have fairness and kindness at the center of what we do. So we have to be fair with everybody, and we're going to be kind to everybody. And therefore, we mustn't choose one location over the other unless we have good reason to. But you make the case for us, and you give us the numbers, and that will speak. And therefore, then we will listen. That's the way. I want to go back to Sarah, because she made a very important point there. You're not fully immunized till you've got both your doses. You're absolutely right, Sarah. And also, just because you're fully immunized, that doesn't mean we can throw all caution to the winds. There will be some people who will be more cautious even after, rightfully so, even after they have had 2 vaccines. And we must respect these people. And our messaging, Una, has to be to the community that you please don't think someone who is masked is being overcautious. They are being cautious for their given situation, for where they are in their lives. And we really need to develop a community spirit here of not to look down, or not to say things to, not to hurt the feelings of those people who will be masking as a change in their risk avoidance behavior for sometimes rest of their lives. Or they may be masking during the winter months and not in the summer months. We are going to develop a new way of behavior. Each individual is going to take this into consideration, and we really need to bring that respect into the discussion from now on. That's part of my respect and kindness agenda, where we really need to have to each other. We learned it in COVID. We don't forget it when we come out of this current situation we are in.
Thank you, Vasa. Yeah, I couldn't agree more. I couldn't have said it better myself. Thank you very much. That's really important. And we'll work to get those messages out to the community via the champions with all your hard work as well. So thanks, everyone. I'm going to hand you over now to Elizabeth and Julia, who are going to talk about the reopening of schools in Merton. As we all know, schools opened on Monday. So I'll hand you over now to Elizabeth.
Thanks very much, Una, and thank you very much for having me here today. It's a real pleasure to come and talk about what's happening in schools at the moment. So I'll just talk briefly, and apologies, I haven't sent any slides through to you, but I can send these through afterwards if it would be helpful with some of the key points. As you will probably be aware, it's been very difficult to avoid it in the news recently. Schools open more widely from this past Monday to all pupils. They've never been shut as such. They've remained open to children of vulnerable children and children of key workers all through the period of this lockdown. And some of our schools have had considerable numbers of pupils in on that basis. They've welcomed them and supported them during that time. Other pupils during that time of lockdown have had remote education. So the wider opening started, as I said, just 2 days ago on Monday. There are some differences to this this opening now in comparison with the last time they reopened after lockdown. If you remember, that was back in last September. And the key thing is that schools have now got access to LFD tests for both pupils and staff in secondary schools and for staff in primary. So what secondary schools have been doing, they've been asked to test pupils 3 times on site. And they were permitted by the government to actually allow pupils on site before this last Monday to start off that process. So some of our schools took advantage of that. They started maybe doing first or second test last week, and then the third test this week, so as to try and minimise disruption to learning. For other schools, that wasn't possible. So testing, all 3 tests are happening this week and beginning of next. So 3 on-site tests for pupils who are returning, and then pupils will move to home testing twice weekly for pupils. So pupils having experienced that LFD testing, being supported with it in schools, then will need to do it with the support of their parents, hopefully, but they'll know a little bit better about how to do it, having experienced it in school. Staff too are offered twice weekly home testing as well. In primary schools, it is just the staff that are being offered tests. Again, this is twice weekly home testing to support situations there. The other key change, which you may have picked up, is that in our secondary schools, masks or face coverings are asked of pupils in all areas of the school, not just in communal areas, which is what it was last term. There are obviously still some certain groups of children and staff who are exempt from mask wearing, and they are being supported to do so as well. In primary schools, it remains as it was in the autumn term, mask wearing or face coverings only for adults in the school where social distancing can't be maintained, and in practice, and it really at the discretion of the head teacher. And in practice, that means that most of our primary schools are asking adults to wear masks in communal areas, and particularly, I would say that applies to visitors. Overall, I should say, however, our schools are being asked to minimise the amount of visitors they have on site as part of their control measures. And that means that, for example, it will impact on parents being able to come into school. It won't mean that parents can't come in at all, but if, for example, schools have got a parents' evening coming up, many of them will be looking at virtual solutions for that to minimise numbers of people coming on site. The other thing that schools were asked to do by the government when they announced this wider opening a couple of weeks ago was to look at their risk assessments, to review those risk assessments and to share them again with staff and the wider community. And I know that our schools have been doing that. And they were asked to look again at the control measures that they need to have in place to keep staff, pupils and visitors safe when they're on site in the school. And so again, that was part of the risk assessments really. And the control measures are very, very similar to what schools experienced last term. So again, if you have any familiarity with that, these control measures would not come as a surprise to you. But just to go through those. Really being the first one is being very clear with staff and pupils and parents that if a person is required to self-isolate, then they are supported to do so by the school, encouraged to do so, asked to do so by the school, and that of course will be supported by a remote learning offer. The second control measure is face coverings, which I've alluded to before. The third one is around cleaning hands thoroughly and more often than usual. So a number of our schools have set up additional hand washing spaces if they're able to do so. Others are making sure that the ones they have in the facilities they already have are well used. They are asked to ensure that there's good respiratory hygiene for everyone by promoting the catch it, bin it, kill it approach. So there would have been assemblies reminding pupils of the need to do this, and again, appropriate facilities and resources around the school to enable that to happen, tissues and bins, etc. Schools will also be maintaining enhanced cleaning of surfaces and other areas, and areas which are touched more frequently. Again, more frequent cleaning regimes. The next one is a fairly substantial one, and again, you will know about this, I'm sure, even if you don't have children, but the idea of bubbles in schools, because schools are asked to minimize contact across the site. So these bubbles will be of different sizes in different schools depending on the school setup, but bubbles, for example, going across a year group or just across one class, and trying to minimize contact between those bubbles. Within the bubbles, particularly for younger children, and you can really understand it, social distancing really isn't possible. Imagine a 5-year-old coming up to you and wanting to give you a hug, and it's not something that you can stop, and their understanding of the 2-meter distance is not really possible. But certainly adults within schools are asked to maintain 2 meters from each other, and social distancing between adults and pupils, and then between pupils, is much more possible the further up the age groups that you go. The next control measure schools are asked is to keep occupied spaces well ventilated. So thank goodness, I would say, apart from it's turned colder again today, but thank goodness generally we're moving towards warmer weather, because schools having to do that means it can get quite cold in school. But again, supporting pupils to do that by perhaps looking at their uniform policy. And further control measures, really schools have to engage with test and trace. So when they have a positive case within their community, or when I say the community, that's the pupils or the staff, they are they track and trace who are the close contacts and advise them to isolate. And in general, part of their control measures, making sure that they engage with our local health protection team, our local public health team. Of course, Julia and Una and Barry being key people there, but also we have other colleagues who support schools really well. So I think it's just to say that with all of that, it seems to have, the first few days, cross fingers, touch wood, long may it last, pupils are really excited to be back, really excited, and lots of smiling faces, and I would say actually that's not just pupils, staff as well, really glad to be back doing what they what they came into the profession for, working face to face with children. So Una, those are my headlines there. I don't know actually whether Julia, there was anything you wanted to add there.
Yeah, just a couple of points. So just to introduce myself, I'm Julia Groom, and I'm a consultant in public health, part of the public health team, working with Barry and Una, and working very closely with Elizabeth. I think Elizabeth's given a really good overview of what's happening in schools. Just a couple of things I wanted to raise was an additional asymptomatic testing route has been set up for households of staff and pupils. So from now, it's being encouraged that the households, people living with school staff and with pupils, also access testing, home testing twice a week. That's the rapid lateral flow device testing. So that's something that, again, we are really encouraging people to take up that offer. You can go and collect, or you can order online, so that you would be doing that twice a week, testing at home. So they're looking at a kind of household approach. The other thing I was going to pick up, and I see there's a question in the chat about vaccination, and a decision was made for the next phase of vaccination, that it was going to, the rollout is going to be age-based, not occupation-based. So you will have seen there has been a lot of push from the teaching profession to say we should be vaccinated. And I think, having reviewed all the evidence nationally, there was a view that actually it's going to be quicker to work through those age brackets in terms of the next phase of testing, rather than taking an occupational approach. But what we have done is offered vaccines to staff in special schools and in additionally resource provision, which is a sort of specialist provision within mainstream schools, because we know that they will have more close contact with students. And the final thing I just wanted to flag is, as well as this fantastic adults community champions, we also have a young adults community champions network, and we have an emerging kind of network and work happening with under 18s, and they have produced some resources. So they produced a first video about lateral flow device testing for young people, and they're now proposing to do a video every two or so weeks, giving updates to that under 18 younger age group about key messages. So I think the really helpful points someone, I think Sarah raised about, you know, what do children need to know about vaccine and what it actually means. They can pick that up and you know, do a video which goes out directly via schools to support that messaging. So I'll stop there, and I'll put the link to those resources in the chat if you want to check them out. The first video is on there. It's about 3 minutes, so pretty short and I think quite informative for young people. And I suppose really now back to Una, I would be really interested to hear you know, your experience of schools or your kids, how you're feeling about it, what issues and things that you want us to pick up or take forward. So thanks.
Thanks, Elizabeth. Thank you, Julia. Yeah, we'll go into our questions and discussion as well. So it'd be great to hear, as Julia said, people's experience, or if you have any questions about it. We'll also link in with the young adults champions. So if anyone has any ideas, as Sarah mentioned earlier, about how we can share messages with kids, particularly as Sarah mentioned on vaccines, we'll do that, and we'll also share the video with you as well on Friday's email. But over to you if anyone has any questions. Slavik, your hand is up.
Yes, thank you, Una. It's not a question, just a comment. Both of my children, they go through the testing twice a week. As a parent, I cannot fault it. It's absolutely great. The system works marvelous. We've got text messages with the outcomes and so on. And we feel quite safe in a way, the school approaching the whole situation. So for me, it's absolutely lovely. I really encourage everyone to do the testing and just follow the rules, to be honest. But as I said, it's really good.
Thank you, Slavik. Has anyone any questions for either Elizabeth or Julia on the work that's happening in schools at the moment, or as Slavik just shared, your experience of the testing program, either at home or in schools?
Una, I can see a question's just gone into the chat from, is it Kumiko? Around public transport. Public transport to and from schools is something absolutely I understand that people feeling nervous about. There is guidance for Transport for London about expectations around mask wearing, face covering wearing on public transport, and there are school specific services that have been set up to ensure that there are enough spaces on public transport. I have to say I've not experienced it myself, so I don't know how crowded they are, but there are some things that have been set up there. Julia, did you have anything that you wanted to add to that?
No, I think you're right. It is an area that people are concerned around. I mean, we can share, perhaps in the Friday update that Una does, we can share any further information, and the links to that guidance that is available.
Perfect. We'll share that, yeah, on Friday.
And Barry has his hand up, I think.
I keep missing people's hands. Sorry, Barry.
Una chairs this very tightly. She's very rarely lets me come into the conversation when she's chairing. It was really a question to our champions that we've had some fabulous insight and intelligence from champions about businesses or concerns about organisations. And so again, champions, if you have concerns about bus routes or public transport, feed them back to us, and then we can use that to kind of speak to the appropriate organisations. So again, that ongoing dialogue that we have through these sessions, or the WhatsApp group, or the emails, if you see anything that concerns you that you'd like to raise with us, Elizabeth, Julia, myself, and Una, please just continue to give us that intelligence, and we can action some of those for you.
Thank you, Barry. Yeah, that's a really important point. And you can, if you don't want to raise it in the group as well, you can always pop me an email outside of the drop-in sessions. Emma, you have a question. Would you like to come off mute?
Yeah, I was just wondering about why school children that are going onto the buses now are not asked to wear masks.
So there is actually a requirement for pupils children over the age of 11 to wear face coverings on public transport. Again, it is a request, it is a requirement. I don't know how it is being enforced, but it matches the rules, if you like, in secondary schools.
So do you think that it would be good for school teachers or in assemblies to remind everyone that over 11 they need to do that? Because I've been on quite a few buses recently around Merton, and as a group of school children, none of them have got masks. They're definitely over age 11.
I know that is something that has happened in the past, but I'm sure we could just maybe remind head teachers to say, is it possible just to check in through assemblies or what have you, reminders, communications that is a requirement.
Thank you.
Thanks, Emma. Thanks, Elizabeth. Sarah, you put a question in the chat. Would you like to come off mute?
Yeah, I know that LEA typically run services for children with special needs and mobility impairments. I'm wondering whether how safe how the service will change from the LEAs.
So the transport service provided by the local authority has continued throughout this time, because children with special educational needs and disabilities have been included within a vulnerable children category. There is guidance again for how that should happen. It's trying to keep to school bubbles where possible, and not transporting pupils from different schools on the same transport, I believe is another piece of the guidance. So it has changed, and I know my colleague Tom Proctor within School Contracts and Organisation has been working hard on that to ensure that again all feel safe and supported.
Thank you, Sarah. Thank you, Elizabeth. Has anyone else got any questions or comments or suggestions? No, you've obviously both done a great job of going through what's happening in schools at the moment. So thank you for that. We'll move on to, we're a little bit early today, but we'll move on to our next steps. So as mentioned earlier, we'll continue to answer your questions and use your feedback to develop the network, and also the feedback that you send us about individual locations or where you need action from us. Please do continue to send them through. We will send out our weekly email on Friday with all of the questions asked today and our responses, and some more information as well that we've said we'd provide. We just ask that you continue to spread the key messages to your networks. Tell family and friends. If you know of anyone who may be interested in joining the network, please do send them our way. And next week we will be discussing support that's available to people during COVID. So whether people are shielding or isolating, have food insecurity or financial insecurity, services that are available to people. So please do drop in again next Wednesday, same times, 12 and 1 and 7 to 8. And have a lovely afternoon, everyone. Thank you for joining us. Big thank you to Aman, Elizabeth, and Julia as well. And Vasa. Thank you, Vasa.